welcome back. This is Dr. Megan kind of joining us just for a minute. She just finished up her smile this morning. So, but anyways, just wanted to introduce you to the channel again. I think you were on a couple weeks ago, or a month ago. And tell me about your smile you just worked on.
Well, we did the front 8 veneers on a beautiful young lady that had a root canal, so she had a darkened tooth. She had quite a bit of wear, so we were able just to widen her smile, change the whole look, give her a bright smile that is now symmetrical and beautiful. So she was beyond thrilled. So
sweet, and you were done quick, about 4 hours.
Yeah.
So awesome.
Yeah. Didn't have to compete, for the mill or
That's
anything
right.
today.
What do you got going on today after you leave?
Oh, family stuff. We're going to do 4th of July weekend, probably with the family, barbecue.
Okay.
Maybe hang out with you and Lauren tomorrow.
Yeah, go to the pool?
Yeah.
Sounds good.
So, it's too hot to do anything besides.
Yeah, if you're outside, you got to be at the pool.
Yep.
All right, sounds good. Well, we'll see you at the pool tomorrow then.
Okay, sounds good. Can't wait to see the smile. Good job, Dr.
Yeah, thanks.
See you later.
See you. Have a good one. So now we're going to go ahead and take off Tom's temps. So you can see he's been wearing these for about an hour, 45 minutes to an hour while we've been making the crowns. And they are getting prepared by Rachel right now. I gave him a little anesthetic. I don't know if he'll need much because of the fact that a number of root canals and a few of the teeth have had so much wear, the nerve has kind of receded down inside the tooth. So we don't have these high sitting nerves. Take a deep breath there, Tom. Does that bother you at all? Any area? Okay. So then I'll make certain we don't have any area that's bleeding that's going to cause us trouble when we go to bond. So I'll check that out real quick. And we are looking very good there. Maybe a smidge, no? So this is kind of the exciting part where we get to start putting some teeth in and seeing how it looks. I kind of lied to you guys earlier. I said we were going to do the lower arch and you get to see it. We'll actually capture that in a before and after video that'll have basically everything you see here compiled into a shorter clip. So you'll be able to kind of maybe in 20, 30 minutes follow the whole process of Tom's smile, and we'll have some good photos of that smile after it's completed. Right? Sounds good. And that'll take about 3 weeks because I think you're somewhere in July coming back. I think July 12th or I don't know, something like that. So Rachel should be here in any second with our teeth, and I'll start prepping this side here. So we'll go ahead and we'll etch the enamel. I know, right? I just couldn't wait. Couldn't wait any longer. Although I wasn't going to get too far because you have the teeth.
I figured you could guess the order on these.
Okay. 1 out of 4 chance of guessing that one right. And I don't think. Well, let's see. Yeah. Nope. There we go. So these probably aren't going to stay very long because of the. There we go. Yeah. Gravity's not working for us there, so we'll get them back. There's 2. 15, 14, thank you. 15, 14, 13, and 12. I've already etched. You just need the motto bond. I'll do the honors of the micro prime. Good catch. Bond? Oh, sorry. James Bond. Let's see if anybody knows that quote. Bond? James Bond? Yeah, it's not from James Bond, though. What other movie not related to James Bond? And who says it? I'll give 30 seconds for that one. Who says Bond? James Bond. The original movie came out when you were very young, Rachel.
I was born in 92.
Yeah, it would have been very young. I think you were alive. Huh? What color? What shade? Bleach 3. So bleach 3 is the darker of the bleach colors and gets into just a little bit lighter than what you typically would find on a natural scale, but it looks really believable still. Angled one. I'll wait. You can get me an angled one. Okay. No worries. There's 2 different tips we can use on this, and one is angled, makes it easier for working on the back teeth, so that's what Rachel's getting me here. I'll need another one here in a little bit, but okay.
Your dad to make a debut too?
Yeah. Is my dad here?
Yep.
Hey, Dad, you're on video. What's up? How you doing?
I think he went to find Dexter.
He ducked out.
Yeah. He saw the camera and was like, nope.
So these are all bonded in. For patients, bonding is different than cementing. Most materials need to be cemented. They can't be bonded, but porcelain, all porcelain materials can be bonded. So just a second here. Great. Now you can go ahead and tack cure the buckle, and I'll floss. I don't see any floss, so. Thank you.
Mm-hmm.
I'll put your finger on that.
Mm-hmm.
Thanks. Okay. Okay. So just a little bit of cleanup here. We're on pretty good already. Got to keep Abby happy. Abby is, gosh, she's related to you. How though? I'm trying to think. She your niece?
Niece-in-law.
Niece-in-law. There you go. Abby's one of our hygienists, and she'll keep me honest here if I leave any resin in there. Resin would, if you leave any of the bonding agent, it'll irritate the gums, and we want his gums to be nice and healthy. So that's why you watch me floss that much. We'll go ahead and rinse and then bond, or cure. Sorry. Awesome. So you've got teeth, permanent teeth in the upper left already, and then we'll finish the upper right. And our other ones should be, front teeth should be coming down out of the oven soon.
2 minutes and 40 seconds.
There you go. Not hurting you at all, are we? Good. It's another thing to note. It's really uncommon to have much discomfort during this process. It seems like it might be uncomfortable, but anesthetic can keep patients numb very well, and don't usually have to worry too much about the fact that we obviously don't want any of our patients to have pain while we're working on them. So Whew, it's already getting warm in here.
I know, and I'm never warm.
Okay. Go ahead and get the right side open big there. Good. Doing okay? Good? All right.
It's habit, Michael, I'm sorry.
Okay.
I'll get 2 minutes stretch for it.
Yeah, let it cool down a little bit. Little adjustment here. Little air right there for him. Little air right there. Good. Good. All right. Okay, thank you. Let it drop there. So here we're just scrubbing in the bond 15 seconds at least to make sure it really penetrates the tooth. That way that we get a really nice connection of our porcelain to our tooth. 15 seconds a tooth is an eternity though. It just seems like forever, but it's worth it. Give it a strong bond. All right, so the answer to the Bond, James Bond question that nobody answered because it's lame, but it is Dumb and Dumber 2. Jim Carrey.
Dumb and Dumber or Dumb and Dumber 2?
Dumb and Dumber 2. Which probably nobody watched, but I did.
So what's the most recent Dumb and Dumber that came out?
That'd be Dumb and Dumber 2. Somebody's probably checking that right now for me, making sure I'm right, but
Only the first one.
another quote by Jim Carrey. Warm. It's hot in here. Warm. He's inside the rhino. Ace Ventura, Pet Detective.
Yes.
All right. Go ahead and clap here. Get the lingual there a little bit. Did you get the lingual? Thanks. So the orange is so that we don't set up the material. So it blocks the wavelength. I think it's the 480 wavelength spectrum that'll call 4800. I don't know, 480 I think. It's that sets up the resin, And then the blue is the exact 480 that sets up the resin. So there's an activator inside that resin we're using that is activated by that special light. We'll rinse that out here in a minute. Now we're just left with the fun teeth, and that's the front 6 there that we'll put on next. The payoff, right?
Mm-hmm.
A little rinsey. Okay. So she'll final cure that, and then we'll start giving anesthetic here on the lower arch. And we'll get started on that after we bond the lower teeth in. And we'll show you guys some highlights of the photos and the all finished product after we've done all that. Whew, warm. It's hot. I bet it says 77.
Is that your guess?
Yes. Got to wear a tank top or something. No.
No.
Swimsuit.
For your summer smell giveaway, get all beachy.
Yeah.
Thanks.
Get a fan in here. So for those who are like hanging on, just so you want to see the smile, what's going to be probably 10 more minutes, maybe 15, and we'll have it all ready for you to see. Oh, you're wearing a mic too. I didn't even see.
What?
You're all mic'd up too. I didn't even know.
Yeah.
Yeah. Fancy. Which mic is that? The short one. Yeah.
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 Well, while you're doing that, I'm going to go ahead in the back
Yep.
and get started on that.
Yep. Okay.
I did too. If I held it down, it said that it's good. You can flash it.
Michael, what time do you got to leave, my man? You got to leave right now?
An hour.
An hour? I just don't want, I want you to miss it. Michael's been awesome all day, but he's got obviously has a family. You're going to take what, your boy to swim practice? Yeah. I think my boy's with you too, swim lessons, yeah. Open real big there. Little pinch here, Tom. Open real big there for me. Pinch here. Open big there. Thanks. Perfect. Perfect. Open again.
What magnification are your loops on that?
Mine are 2.5 magnification. I believe they're designed for vision. I've had Surgitel before. I like these frames and they seem to be comfortable. And then the light, open real big there for me. It's escaping me right now which light we have, but the light makes a big difference too. So 2.5 seems to be a good magnification for restorative dentistry. If you're getting into endodontics, you might want more than that. If you're doing quite a bit of molar root canals or anything like that. But too much more than 2.5, you're going to miss the forest through the trees, or whatever that saying is. You kind of miss how everything should relate if you get too zoomed in. So I do think magnification and lights, I was going to actually make a video discussing that. I think it's I think going to a dentist that uses it is a good idea, and I think as a dentist we ought to be wearing them. Without them, it's probably the best tool you got, because you can't see what you can't see. So a lot of times I find stuff that patients say they've just been to their dentist, and it's pretty obvious, but if you didn't have the light on it and maybe you didn't have the magnification on it, it wouldn't be very obvious. So it's a helpful tool. And missing something on a patient's not, ignorance isn't bliss, right? So ignorance is a problem down the road, and then it's a bigger problem to fix. So she's just finishing up, man. We're gonna have the front 6 done, and you should start to feel numbness down your lower jaw, right and left, your right side, left side of your tongue. If we're not seeing that change in a few minutes, I might give you a little more, but is it changing for you at all? Yeah, that's good. Yeah, it's wild how much more room we've got. Looking at this photo, it's just like, what? It's great. Here's the lower arch. I don't know if you can see that, but that's what we'll be prepping here shortly. Designing that. Got it? So once we've transferred that, just to maybe fill in a gap that some people won't see, once we transfer the wax up today after I prep those teeth, we will make some minimal adjustments to his bite, and so that way he'll hit evenly. The goal is that you hit solidly on both sides. Obviously you're going to be open a little bit more than you were when you came in, and then over the course of the next few weeks I'll give him a call, follow up with him, make sure that the bite's okay and that he's not having soreness or pain or issues with the way that his jaw currently sits. So if there is, then we can always reduce the lower teeth and make them a little shorter to help that comfort level be improved. But that rarely do we need to do that. So I've done a number of these, and it's just rarely that is the case. So. Just kind of waiting on Rachel at this point. You got video on her back there? Put the pressure on her. It's a good reminder again. So if you're still watching and you may have heard of the Summer Smile giveaway and you haven't nominated yourself or maybe a friend yet, that would be a good time to jot down the site. It's summersmilegiveaway.com. We have about 100 entries, which is really cool. I mean, we're only been, today marks 1 month, right, Michael? I mean, so basically had it live for 1 month. We have one more month of entries, so it's going to be a great opportunity for those that are wanting to have their smile transformed that couldn't maybe afford the care to do that. We're going to take care of it all if you win the contest, and we're pretty excited to see who wins, and all the directions there are at summersmilegiveaway.com. And number one question we've been getting is, what if I live there? Well, anybody. So anybody across the planet Earth we'll fly you here. And I know that that's expensive. We're going to do it. We just want to have a lot of fun with it. It's going to be an amazing, life-changing experience, and so we'll fly you from anywhere, even if it's a real pricey place to get you from. If you win the contest, we'll get you here, transform your smile, and send you back home, and have a good time doing it. Cool. Woo. So now the real fun part. I'm waiting essentially 9 months or so for this part, right? Yeah.
Oh, wow.
Mm-hmm. Good deal. Okay, sir. By the way, if you're seeing the gums and you're wondering how long it might take for them to bounce back to normal, typically it's a couple of days. So, very quick. In this brush here, we use microprime. It's a material that helps with sensitivity, helps cleanse the tooth. That way we don't have to worry about anything causing sensitivity or be getting in the way of our bond strength. The white tips you're seeing on these teeth, if you're looking at the close-up view there, those are the buildups we did the initial appointment we started in the Invisalign scan. So when Tom came in to start Invisalign and we took the 3D iTero scan, I built those up, cleaned up the teeth, built those up, and you can see they're still nice and strong and allowing us to get a little bit of additional height out of the tooth. Thank you. And Rachel here has been a rock star. She helped us on the last one too, and she's doing a great job. So, way to go, Rachel. It's a good time to brag on our team. We have an amazing team here at Innovative Dental that's really skilled, very committed to patient care and giving great experiences. All right. All righty. Go ahead and tack cure the facial there. Tack cure is just where we know we've got good seat, and we're going to go ahead and do 3 to 6 seconds to help the resin start to set up, but not get solid.
Hence the word tacky.
Yeah, tacky, yeah. And then it'll kind of, I can flake it away pretty easily, and that's what you're seeing here. Thank you. You'll never have to floss this much at one time ever again, Tom. I guess unless you have a ton of beef jerky, maybe sometime. Okay, you can rinse off there. Okay, I'm excited to let everybody see your new smile here. Final cure, and then I'll floss one last time. Well, I'll just floss right now. We're good. Okay. You got a good before and after to show here? Sweet. So obviously we'll show you just because you want to give those who watched it a payoff on what the smile looks like when we're done. You know, the photos will be nicer because his gums will have healed and won't be as red and irritated. So, but at least gives you an idea of what it looks like.
Dexter hasn't.
Dexter's
out
been
yet.
quiet, yeah.
I know.
Staying in the back. Do 10 front, 10 back. Yeah.
How many appointments total will he have by the end?
Oh, well, the restorative aspects of the full mouth is 2 appointments. But the Invisalign, I don't know, maybe you had, what, a half dozen of visits? 4 to 6, something like that. 4 or 6 visits. And everybody's Invisalign or moving teeth is going to be a number of visits. But so over the course of the past 8 months, he was in every couple of months or so. And then today, obviously, and then one appointment down the road. We're going to, you saw how long it took to prep an image. So that'll be a couple more hours today. So we'll be done right around 3 o'clock. And he'll have upper and lower. So if we're done around 3, it's about a total of 6 hours to transform all the teeth. The uppers are permanent and the lowers are will be temporary. And he'll come back next, and it's like 2 or 3 weeks from now to get the lowers permanently bonded on. So let's let everybody hear. Let's rinse and then let everybody see what that looks like. There you go. So, and I won't use my light again this time. Although, do you want to bring more light in from the outside or no? No. Okay. Tilt your chin down there for us. There you go. So you can see the upper arch. Got it? Sweet. Okay. Cool. I know, right? Let's let you see. Yeah, let's let you see. Grab a mirror.
You ready?
There you go.
Let me take these off. Yeah.
I got teeth.
You
Yeah.
got teeth?
Got teeth.
Yeah, let me do this and I'm gonna.
Yeah, you can kind of.
Yeah.
You got it.
I got it.
Yeah.
There, you can really see how they'll match your face too. So the lowers will match perfectly, so we'll do those. Even your temps will be close to that shade there. So, all right, good. Well, thanks for tuning in to this live event. I hope it was something that everybody that at least spent some of the time on the channel watching this could have gotten something out of it. If you have questions, obviously make sure to post them in the comment sections below. We'd love to engage with you there. We'll continue watching the channel and subscribe if you haven't already, because you'll want to see. We'll upload a video. It might take some time, but it'll be Tom's case here from start to finish, probably 20-30 minutes with the highlights of what this will all look like in the end. But we'll make sure we recap all those cool details. So anyways, anything else I'm missing?
I can take that.
No? Okay. Have an awesome weekend. Thanks for watching.